is.
We're just talking about eye treatments.
Alright, I'm making sure I can hear you.
Okay, perfect. Alright, so once those 6 passes are done, now you're gonna move over to the next area, okay? So we're gonna go to diagram B. You can treat the sub-brow area. So what I like to do for the sub-brow area is I actually lift up the skin here. You can probably get anywhere from 1 to 2 vector rows in, depending on somebody's age. As we age, we'll typically see more of a gap between the actual eye itself and where the brow is. Younger patients, maybe you'll only be able to get 1 in because you still have quite a bit of fat here, okay? So you're just gonna lift up, and then you're going to apply pressure, make sure you're on the bone, and you're just gonna do 10% overlap. The second pass that you do, you can kind of squish down and scoop. And then that would be it. You do that for 6 passes, and that's it, okay?
All right.
Once that's done, now you're gonna go over to C, diagram C. That's gonna be the crow's feet. You can probably get like 4 vector rows in. How many did we say? Yeah, we said 3 on here, but you can probably get 4 in, depending on, where somebody's lines are. Like a lot of times in men, you'll see that they come down here. If that's the case, then you're gonna follow the line, kind of travel along it to help build up the collagen in the area. So you're gonna do that for 6 passes. And I typically will just follow the crow's feet. Okay? And then lastly, you're gonna work above the brow. So you can kind of get a nice little brow lift. You're doing 2 to 3 vector rows there. And you do that for 6 passes. That eye is now complete. Now you can move over to the next eye. When you do that, you're not starting at the same amount of joules you were at on this eye. There was a spread of heat here, so we could maintain, the joules we got towards our end point. Here, we're gonna drop back down to 40 again and get up to the same that we were on the other side, okay? And then that's it. That's a whole eye treatment. And then we have our Plump RF protocol. So this is going to be for the lip plumping. This is going to be perfect for people who don't want filler. They're not looking to put something into their bodies that they're not comfortable with. Maybe they're terrified of needles. So that's really put them off to not getting injections. So now we have all the plump without the poke. So what you're gonna do is apply gauze in between the teeth, almost like you would place an orange peel in the mouth, just to protect the teeth so you don't accidentally hit a tooth. And maybe somebody's got a couple dental implants, and maybe there's some sensitivity there, so it just helps with that. So you're going to apply that gauze in the mouth, put 2 millimeters of ultrasound gel, maybe even 3 millimeters around the mouth, and it's gonna be a total of 4 vector rows that equals 1 pass, okay? So you're gonna be in mode 3. You're gonna start where the perioral lines are, okay? And you're just gonna go boop, 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 boop. Okay, that was 1 row. The second row is gonna come directly over the lip. So boop, 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 boop. The third row is gonna be the perioral lines down here. Boop, 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 boop. The fourth is gonna be on the lip.
And that's 1 pass.
1 pass, yep. So you're gonna do that 5 more times, and again, just in between
So
passes.
all of this in here is
1 pass, yep, 1 pass. You're gonna do that 5 more times. Yep, exactly.
and that's a treatment.
Yep, and that's the treatment.
And then they come back when?
2 to 4 weeks.
2 to 4
Yep, for 4 to 6 treatments. And it's important to note too, you wanna be careful, of course, but you want your speed to kind of come into play with this too. We can't measure temperature with this. We're not like we do with V-form. So you wanna make sure that you're maintaining temperature, and the way that you know that is if you complete a pass within 2 minutes. So if you're doing that, you're good. If you're not completing a pass in 2 minutes, maybe the size of the area is too large. Maybe you need to kind of narrow it down, make it smaller. So, rule of thumb. You could be too slow, yeah. So you just wanna make sure you have a nice, steady, healthy speed. And then also that you're not treating larger than the palm size of a woman's hand. That typically allows you to maintain enough heat in the area. So you're gonna treat this side first, then this side first, then this side on the neck, then this side on the neck. You're not going 1, 2, 1, 2, 1, 2, 1, 2.